Good morning. It's Dr. Ara Dugmajian, CEO and founder of the Duke Spine Institute. We are broadcasting spine surgery live to you on April 17, 2025. Our patient has horrific back pain that he deals with every day. He's had it for 6 years. He has pain going from his back, also down his leg on the right side. He's had surgery in the past, not by us, but by a spine surgeon who performed a discectomy, and that was done at L4-S1. He has a degenerated L4-S1 disc, but it's reherniated. It's causing back pain through an annular tear and inflammation within the posterior annulus. We call that annulitis. He also has a tear in the disc annulus at L4-5 on the right side, and he's got herniation coming through that tear. It's bulging. We call it a bulging disc. And that is new, and that's causing back pain and also right leg symptoms through the process of inflammation within the tear. Now, there's 30 things that cause back pain commonly that are chronic back pain. And each of these things we're talking about are very specific joints, like discs. There are 5 discs in the lower back. There are facets, 10 facets in the lower back, the SI joints and the piriformis muscles, as well as bones can fracture. Between those diagnoses, that's 99.5% of all back pain. 99.5% of all back pain is now curable with one of our procedures at Duke Laser Disc Repair. Henry, let's show the audience the causes of chronic back pain. I'm Dr. Ara Dugmajian with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke Laser Disc Repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The 4th most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. And welcome back. You can see from the video we just showed you that there are 30 distinct causes of lower back pain. 99.9% of doctors don't know these causes, all of them, and they don't know how to diagnose your pain in your back. We do at Duke Spine Institute. We use a proprietary examination called the Duke Spine Exam to make the diagnosis for you what's causing your back pain. Now, the average patient, we looked at 5,000 patients with chronic back pain, 5,000. We had actually an out-of-state Princeton undergrad student did this as his research project for the summer. He took 5,000 patients that visited Duke Spine with chronic back pain and analyzed their diagnosis from the charts and records. It turns out that 85% of all chronic back pain, that's back pain lasting more than 6 weeks, 85%, the primary cause was a disc injury. That's a bulging disc, herniated disc, ruptured disc, protruded disc, extruded disc, slip disc, bulging disc, spondylitic disc. Okay, so there's 10 different diagnoses for the same thing. The second most common cause of back pain, 10% of primary patients' back pain, and actually 50% of all patients with chronic back pain have facet pain. Now, it could be 1 facet, 2 facet, 3, 4, 5, 6, 7, 8, 9, 10. There's 10 facets in the lower back. And then another 2.5%, their primary cause was SI joint arthritis. And then another 2.5% was piriformis muscle. And that's a tear in the muscle. That's about almost 100%. So it's really just small number have fractures. Less than 1% of patients with chronic back pain have a vertebral body fracture, which is fixable. So 99.5% of all back pain is fixable, 100% curable at Duke Spine Institute. But you can't go anywhere else in the world to do it. How is he doing? Is he awake?
How are you doing, my friend? You okay? Good. We're going to ask you a question now, okay?
Give me one more minute. So basically, this patient had a microdiscectomy before he got to us, all right? He had leg pain. And microdiscectomy is a old surgery we've done for many, many years. And that microdiscectomy is unfortunately invasive. We have to make a big cut, peel the muscle off the spine, remove bones and ligaments, take them out, drill them out, make a hole in the back of your spine, and then move the nerve over just to try to pick out some pieces of herniation. It's a terrible procedure. We don't recommend it anymore. This surgery replaces all microdiscectomies and is much safer and better because we're not taking bone and ligament out. Henry, let's show the audience what a microdiscectomy is.
A large incision is made. Muscles are torn from the spine. Substantial bleeding occurs due to muscle trauma. Normal, healthy bone is removed to access the herniation. Stabilizing ligaments are removed in order to access the herniation. An incomplete portion of the herniation is removed. Dense scar tissue forms. Weakened bones can fracture, leading to instability and pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.dukespine.com.
All right, welcome back. Thanks for watching our video on microdiscectomy. As you see, it's a destructive procedure, very bad, avoid it, but he had already had it done years ago. I just asked him, how long have you had back pain? He said 7 years. And it affects his work, it affects every aspect of his life. Are you comfortable? All right, he's doing fine. How bad is that on a scale of 1 to 10?
Give us a number.
How high does the pain go? 9.
Okay.
Is that where your pain is normally? Yeah. That was L4-5. L4-5, 9 out of 10. Concordant. All right, is it better now? Is it better?
Head still. Good.
All right, Monica, show us the tear. Henry, go over to the x-ray. Guys, we just injected L4-5, and you can see there's a tear. Show us the tear in the back of the disc. Yeah, so the black is filling the tear. Now go to the middle of the disc. Now right there where the arrow is. You see the arrow, Henry?
Yes, we do.
Make a small circle. Go ahead, Monica, make a small circle. Bigger. The nucleus where we're injecting the dye is right there. Now the dye should not go to the right of the arrow. Move the arrow. No, it's too far. Go back to the center. Move it to the right slowly. Stop. Right there. Do you guys see how there's a curve at the bottom of that dye? No, to the left. There. Right exactly there. That's where the annulus starts. And when you inject the black dye on the x-ray into the middle of the disc, it should stay in a cotton ball right there. Now go back, please. Go back. Come on. Now, going to the right of that spot is all annular tear. And the black stuff that you're seeing is nucleus or herniation in the annular tear, and that's where the inflammation comes from. Come on, move it around and show us the whole tear. It's a big tear. Yep, that whole thing is a tear, and the black dye is inside the tear, showing you the tear. That's how we see the tear. It's called the posterior annular tear. It's humongous. That's L4-5. Are you okay? That's where his back pain's coming from, the annular tear, and we are the first in the world to discover this fact and to fix it. I was the first to fix it 21 years ago. And now we've been doing the laser surgery for basically 20 years, and we've done over 2,600 surgeries with 99.6% elimination of back pain on average. That's reported by the patients. Are you comfy? How bad is that on a scale of 1 to 10? Huh? Is that a 10? That was your old disc, the L4-S1, the one you had a microdiscectomy done. That was a 10 out of 10. He said, holy shit, it hurts so bad. That's what he said. So it's an HS. Is that where you get your pain? All right, he said it is. So it's concordant. So we got 10 out of 10. Concordant at 5-1. We got 9 out of 10. Concordant at 4-5. You get to go to sleep. It's time to count out loud in Chinese. Tell me if he's counting in Chinese. I don't believe it. Folks, keep counting out loud. He's counting in English. Thank God. All right. It would mean something very important, which we won't discuss right now. Anyway, long story short, he's counting in English, thank God. He's a true American patriot. All right, folks, check it out. This is a 7mm, 1/4-inch incision, size of a Band-Aid. We're doing 2 discs. If he had gone anywhere else to fix this, it would have been a fusion. We'd be looking at an incision that's, a fusion is this big, and you got to peel all the muscle off the spine, make a huge cut, a lot of scar tissue. You got to take out the discs, put in cages filled with cadaver bone and patient's own bone, and then put in screws and rods or an artificial disc. Very dangerous surgeries. We're doing this through a 7mm incision. We've done 2,600 plus, and we've never had a complication from this surgery, not one. That is the safest spine surgery in the world to cure back pain. Henry, let's show the audience just how discs cause back pain and how we fix them with the laser.
Disc injuries start with an annular tear, damaged nucleus. Pulposis herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922. Disc injuries are a common cause of chronic back pain. The inflamed annular tear causes back pain. A 1/4-inch sized skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website or call us at 1-800-FIX-MY-BACK 349-6922.
And welcome back. You can see from our video that what we're doing here is an annular debridement. We're not doing a discectomy. We're not doing a fusion. We're not putting in a cage or anything else. We're basically we're cleaning that tear that I showed you earlier with a laser. That's what we're going to do. And by doing that, it gets rid of the back pain. It gets rid of the leg symptoms completely. 100%, 99.6% gone. And look at the amount of bleeding we've had. We've literally lost maybe 5 drops of blood the whole surgery. This is bloodless. There's no hospitalization. There's no post-operative narcotics needed. This patient will not take narcotics after surgery. He will only take some Tylenol or Motrin and maybe a muscle relaxer tonight. That's it. The pain is gone by tomorrow. In 90% of our patients, the surgical pain is gone by the next day. So his pre-surgical pain is going to be gone when he wakes up. This is the only curative surgery in the world for back pain. The only surgery in the world that is specifically to eliminate and cure back pain. And it was developed by myself here at Duke Spine Institute. We have other treatments as well for facets, SI, and piriformis. And they're also curative, and they are patented in the United States Trade and Patent Office. Okay, any questions?
Yes, we have a question coming from Lanu on YouTube.
Hi Lanu, welcome to our stream.
asking, this patient is only 38 years old and his herniation on the MRI looks pretty serious. I assume he had some kind of accident?
I don't recall what accident he had, if he had one, but you've got to remember every single disc bulge or disc herniation is traumatic, every single one. There is no way to get a disc bulge without trauma to your spine. And it could have happened a long time ago. It could have happened in the birth canal. We've seen patients where it's happened in the birth canal when they were being born. They have no history of trauma, but they had a vaginal delivery or a C-section where the surgeon or obstetrics gynecologist or midwife, pulled a little too hard and probably damaged their spine. Of course, a newborn baby isn't going to tell you that they had spine injury, but later on in life it manifests. So we see it. I've seen bulging discs, degenerated discs in 10-year-olds, 5-year-olds. I've seen them in 2-year-olds. We have people from all over the world contact us to review their MRI. I've had 2-year-old babies with degenerated discs. That means that they was injured when they were coming out of the birth canal. We're probably the first in the world to identify that and talk about it, because who else gets an MRI of a baby's spine? Like, I didn't order this MRI. The mother had gotten it done because she felt like the baby was having something wrong with their spine. She was very smart. She got the pediatrician to order the MRI on a 2-year-old. They got it done, and I looked at it and I saw that the baby had a L4-5, L5-S1 degenerating disc from a disc injury. It must have happened in the birth canal. So that's how I know it's a fact that there are birth canal injuries in people, and nobody ever talks about it. My father was an OB-GYN at USC. He was a professor of OBGYN and served in the military, and basically never once probably in his life thought that the OBGYN could actually cause an injury to the spine of a baby. It's never been talked about, and of course MRIs have only been around for 40 years now, 40 years, so nobody has any data on this, but I think it's more common than people think, than they expect. Something we need to talk about and educate doctors on, especially OBGYNs that are delivering babies. All right, look at that. See the pink stuff right there? That is inflammatory tissue within the annulus fibrosus. That is the source of the back pain. And that's what we're removing with the laser. Now for reference, this laser fiber, you guys see that glass fiber at 12 o'clock? That is a 1 millimeter fiber. 1 millimeter. That's how precise this surgery is. It uses a 1 millimeter fiber, and the surgeon can control the delivery of therapeutic laser energy up to 0.05 millimeter, 0.05. There is no other surgical tool in medicine that is as precise as a laser. A laser used endoscopically is the most precise tool we have in medicine. Even if you use a gamma knife or a linear accelerator to target tumors in the brain or brainstem, the precision is not as good as 0.05 millimeter, which is basically take 1 millimeter and divide it into 20 parts, right? And that's how precise I am with my targeting using this laser under this setup with endoscopic surgery. It is the safest and most precise surgery in the world. That's why we've had 0 complications. Any questions?
At this moment, no current questions. So in the meantime, why don't we show how it is the second most common cause of back pain, the facets, cause back pain, and how it is that we cure it.
I love it. So Henry's on to something here. We started out this surgery by talking about the 30 different causes of chronic back pain. Now remember, chronic is not acute. Acute back pain is different. Acute, if you do something and wrench your back and you've never had back pain before, you might have back pain for a day or two. Or if you get into a car accident, you might even have back pain for a day or two, then it goes away. That's not chronic back pain. Chronic back pain is back pain that you have constantly or intermittently, comes and goes. that lasts more than 6 weeks. And it turns out that 850 million people in the world have chronic back pain. 850 million. If you add chronic neck pain to that number, it's over 1 billion people in the world. These are the WHO numbers, I believe, have chronic back and neck pain. 1 billion people. We can, at Duke Spine now, cure all of those people from chronic back and neck pain, as long as it's not due to a tumor or infection of the spine. And those infections are very difficult to treat, and we don't see a lot of spine infection in America. They're more common in countries like India, where they have tuberculosis rampant among the population. And tuberculosis is probably the most common infection of the spine in the world, and almost all the cases are in India and countries in that area where tuberculosis is rampant.
And then prostate's the most common cancer of the spine, right?
Yeah, and the most common metastatic tumor to the spine is actually lung cancer. Yeah. Prostate is a very common one, obviously, in men, and breast cancer can metastasize. There's also primary tumors of the spine like multiple myeloma, plasmacytoma, osteosarcoma, chondrosarcomas. I mean, there's a whole list of tumors, but thank God they are rare and rarely seen. We don't treat those type of tumors today in 2025 at Duke Spine. You have to go to a university setting where they have oncologists, radiation oncologists, medical oncologists, and surgeons, surgical oncologists that specialize in treating these types of tumors, because a lot of times they spread throughout the body and they need adjuvant therapy like chemotherapy and radiation. And of course monitoring and a whole host of therapy like physical therapy and occupational therapy modalities. And we don't have those resources yet at Duke Spine. Someday, maybe, but not yet. Any questions?
Yes, we have a few questions. This first one is coming from Lanu once more on YouTube,
All right, sure.
asking, does the spine injury risk goes up for a baby if it's a C-section delivery?
Yeah, great question, Lanu. You are basically asking a question based on my observation that there are spine injuries that happen at birth. And the problem is nobody's ever looked at this. Like, no university or doctor has ever studied disc injuries in newborn babies. It's something that I've noticed in doing my MRI reviews, because I don't usually turn away infants or babies or children when I do MRI reviews. I do it for everybody, and I get people who actually have MRIs that are 2 years old, 3 years, 5 years, 10 years, 15, etc. So I see very young patients on my MRI reviews, and I've seen degenerated disc. But it's not a known disease of children or infants, but it needs to be considered now because I've seen it, and it does exist. And we now have MRI scans that are being done on young children because they have other conditions, and people need to start looking at their lower back and see, do they have an injury to the disc? So I can't answer your question because I don't have enough information. All right. If you have other questions?
Yes, we have about 2 more questions.
All right, we'll take those, and then we can run the video on facet pain, the second most common cause of back pain.
Of course. Second question coming from Henmeister on YouTube.
Henmeister.
Yes.
Hello, Henmeister. Welcome to our stream.
Asking, I was hope you are doing well, doctor.
Thank you.
I was wondering how many surgeries you do a day and what got you into spine surgeries.
Wow. Well, thank you for asking. It's an interesting question. I'm going to just say that Duke Spine Institute, even though we have the cure to back pain, I hate to say this, but nobody in the world knows that. Just a few people, like literally a few thousand people probably know that. And we're trying to get the word out, but we don't have any help or support from anybody but our viewers and our patients. The reality is that there's a lot of powerful companies that have a lot of control of the media, like hospitals and implant companies, and they do not want this surgery known about to patients. They don't want people to know about the surgery because it takes away their business. It takes away their profits if patients know about this and choose this better treatment. So the answer is we don't have a lot of people that know about our treatments. And we're trying to change that through YouTube and our website. But we're a small company. We don't have a lot of money. Our marketing budget's only a few $100,000 a year, and that's really to pay salaries of people like Henry and my digital marketing team. But we don't spend any money on pay-per-click or TV or any type of advertising. We need to, but we just don't have the money. So unfortunately, we have these great surgeries that fix people, but we can't get the word out because we don't have the ability to do that. We don't have access to good marketing, or the media, the news don't care, you know. They don't care if you've cured back pain. They take stories that people pay them to put out there in the media. All right, they're very selective, and the media is only covering not great discoveries like this surgeries that we do, but they cover what people pay them to cover, okay? And again, it comes down to money. So when you ask me how many a week do, I probably do on average right now about 5 surgeries a week, but I mean, I should be doing thousands a week because the people are out there that need to be helped, and we just unfortunately don't have that much recognition of what we're doing yet. Now, the other thing is a lot of insurances don't want to pay for this type of surgery, so they deny payment because it's a newer technology, and more importantly, they don't want to cover something that actually works because then everybody's going to want it. So we have fights with insurance companies often to get coverage and payment for the surgery, and a lot of times patients have to pay out of pocket, and not many people can afford spine surgery, even though it's a lot cheaper than open spine surgery, and we don't have the complications and bad results that you have to keep paying for. So there's a lot of financial benefit to the surgery for patients, but a lot of people just can't cover the upfront cost. So when you ask how many, probably averaging 5 right now, but we should be doing a lot more. We just don't have the patient volume yet. Hold on. All right, I think I'm just about done with 5-1. I'm going to try to get a little bit more. What you're seeing at 12 o'clock is a little inflammation in the posterior longitudinal ligament. You see some veins up there, a little bit of fat. Those veins and fat are in what's called the epidural space. That space right there that you're seeing at 12 o'clock in the tube is the epidural space. And that's where doctors put steroid medicine when they do an epidural steroid injection. Just about done with 5-1. This was the disc that he had the microdiscectomy done. Remember, he had a surgery in the past elsewhere, and it didn't work. He's here now with back pain that the microdiscectomy did not fix. It's a fact, folks. Microdiscectomy does not fix back pain. It is a surgery that is supposed to treat a pinched nerve, which causes leg symptoms like weakness, numbness, tingling, but it does not fix back pain.
We have another question.
Sure.
Coming from Pavel on YouTube.
Pavel or Hobble?
Pavel.
Pavel. Yeah, we've had Pavel before.
Yes, we have. Asking, hi, Dr. Duke.
Hi.
How do you determine the entry of the endoscopic entry, and does the angle change depending on disc herniation?
Yeah, I'll answer your question in a moment. So there's the annular tear. We've cleaned it out. His body will seal that tear. If you understand, the tube itself is around 5 millimeters wide, and the fiber is 1 millimeter. That's about 1.5 millimeter tear. So 1.5 millimeter tear. We're done, and we're gonna now put some antibiotic and clean it up. But we're done with 5-1. Okay. Scope off. So the determination of my entry point, my trajectory, and is not determined. It is determined by a lot of factors, many factors. One of them is the angle of the disc, the size of the herniation, the configuration of the spine, the curvature of the spine, the lordosis, kyphosis of the spine, the scoliosis of the spine, the facet joints, are they enlarged, are they normal, the size of the patient, like how big is the patient, and then where's the spine relative to the inside of the patient. Is the spine anterior or posterior? And then of course there's the pelvic structures and the abdominal structures that you have to avoid, like intestines and kidneys and ureters and blood vessels. So it's a very complicated trajectory. I make it look easy every time. That's because I've done thousands of these. And I've done 2,600 patients, but also remember, I have, in each of those patients, I did 2.4 discs on average. So if you multiply 2,600 times 2.4, you get the actual number of needle passes I've done and endoscopic passes I've done. So that's a lot. It's like 10,000, close to 10,000. I stopped counting, but that's a lot of surgeries, a lot of access to the disc. So it's multifactorial, and there's a lot of things you have to take into consideration. Okay, we are done with 5-1. I need a little pressure here. Yep, hold on, let me just see. Good? All right. So we've lost probably maybe 5 cc's of blood, let's say 200 drops of blood. 200 drops, so it's 20 drops per cc. So that's 5 and 5 is 10, so maybe 10 cc's of blood so far. It's relatively bloodless surgery. We've never had to do a transfusion ever. Unlike open spine surgery where they do transfusions often. Shot? All right. There we go. I'm going to put a little numbing medicine. This is for the fascia. The fascia is a pain-sensitive structure, and that's to make him more comfortable. Any other questions?
Yes, we have another question coming from Lanu, once more on YouTube.
Yes, Lanu.
saying, I'm running out of questions for Dr. Duke. Have you ever get a question or comment from viewers that you got you laughing all day?
I don't know. That's a great question. Hold on. Yeah, feels good. Honestly, I probably have. I just can't remember it. But I do have a good sense of humor, and I appreciate you as well having a good sense of humor. All right, let's show the audience the second most common cause of back pain. Remember, hold on. We got to put that dilator back in. It's pushed out. Look at that. See the dilator literally pushed backwards?
Yes, we do.
Oh yeah, right here. Look at this. You guys see this? Bong, 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 bong. Why is this happening? Shot. It's happening because, oh, look at that. Watch this. Watch the dilator. Watch this, Henry. Can you get the camera on here?
Yes, we can.
Tell me when you're ready.
Perfect. We're right there.
All right, so I put the dilator into the tear and the disc, but remember, what causes back pain is inflammation. 100% of back pain is due to inflammation. The question is, where is the inflammation? The disc, the facet, the SI joint, the piriformis, or the bone that's fractured? Right now, it's in this disc. This is the L4-5 disc. Watch what happens here. I'm going to take my thumb off, and this thing is coming back. It's slowly creeping back right now. Shot. It's actually staying now. Okay, there it goes. But it was pushing out very easily, and we don't want that. We got to get the tube in. That's a sign that there's tremendous pressure inside the disc. Shot. All right, we're in. We can take it out now. Go ahead. What causes that pressure is inflammation. Remember, when you get a zit on your face, that's inflammation. What's happening is there's swelling, extracellular fluid inside the area of the zit, and it causes the zit to push up and be swollen. And remember, those zits are painful. When you push on them, they're tender. So the disc is the same. He's got a swollen disc full of inflammation. It's very painful. And you could see evidence of that by pushing our dilator out. All right. Did you show the facets?
Not yet.
Let's do it.
Of course.
For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922. Facet joint injury is a common cause of chronic back pain. The inflamed facet tear generates pain signals. The best treatment for facet joint pain is the Duke plasma rhizotomy. Inflamed facet joint pain nerves are destroyed. For more details, please visit our website or call us at 1-800-FIX-MY-BACK, 349-6922.
Seeing the patients with Luis. All right, welcome back. You can see from our... they were supposed to have talked to you already. You can see from our video that the facet joint can become injured with trauma, just like the disc. As a matter of fact, if you understand what's called the motion segment of the spine, which is the two vertebrae, the one above and one below, and when they move, they can move in rotation, flexion, extension, or lateral bending. They have full 360 degrees of movement, not in a 360-degree rotation, but they have limited flexion, extension, limited rotation, but they can move in all directions, okay? So you've got these two vertebrae that are moving with respect to each other, normally with bending, twisting that we all do during our daily lives. And you've got joints between the bones called the disc, between the vertebral bodies, and the facet in the back. You've got a left and a right facet. So if you get trauma to your spine, it doesn't just rip the disc, it also rips the facet capsule. And that's what you saw in that video. And when the facet capsule gets ripped, the facet joint over time degenerates because it's wobbling around and it goes through extremes of motion. When you twist and bend, it goes beyond its normal 3 or 4 degrees of rotation and it goes to 5 or 6. Well, what that does is it puts a lot of pressure on the cartilage surfaces that they normally don't have, so they degenerate quickly, okay? So the point is, the injury to the facets occurs through trauma, just like it does with the disc. But the facets can become arthritic and painful over time. And the best treatment in the world right now for that is the Duke plasma rhizotomy. Once again, a treatment pioneered here at Duke Spine Institute and patented in the United States by myself and of course with the assistance of my patent attorney. But you can get that treatment done here at Duke Spine. There's a reason why we offer these treatments at Duke Spine and we're not out training a bunch of other doctors. And the answer for that is called quality control. I want to make sure that the patients who have surgery, a Duke Spine procedure, get the very best procedure, the very best care. And what I've seen over the years is that doctors tend to cut corners to save money and be more profitable. And Henry actually has a video coming out later today on a doctor in our area who was just reprimanded by the Board of Medicine. She's a pain management doctor. And apparently, to save money and be more profitable, she stopped properly maintaining her sterilizers in her center where she does pain procedures. And she stopped following the laws with respect to the use of medications to treat patients' pain. She would use medication vials over and over again, and exposed patients and basically infected 20 patients or more with hepatitis C virus. Okay? They've now basically taken her license away, and she's going to undergo criminal prosecution. Now, she's been around for 30 years in this community. Okay? And we're going to release that video today, right, Henry?
Will be concluding it today and then patching and upload by tomorrow.
All right. So why are we telling you this? Because you need to understand that there are many doctors out there that make choices to cut corners on patient safety and efficacy of treatment for one reason, so that they can make enough money to stay in business and be profitable. Part of that is driven by the insurance companies not paying for procedures and forcing doctors to be more resourceful. But there's a line that doctors should never cross, and that line is a line of quality of care. And I've seen it happen over and over again. It's not just this doctor, but many, many doctors have done this. And that's why I don't want to train just any doctor on my treatments that work, because they're going to go out and advertise them, they're going to get patients, they're going to do surgery, and they're going to hurt people when they start cutting corners. And I don't want my name and my procedures associated with bad results when they never should be. That's why Duke Spine has kept our treatments at Duke Spine, and if you want the best, you come to Duke Spine to get it. You have to fly, so what? Fly. You know, we live near Orlando, Florida, the #1 destination for people flying, and you have people from all over the world coming to Florida for Mickey Mouse, all right? So maybe it's time people stop coming for Mickey Mouse and they start coming for their health and well-being. And that's really the main point here, is come to Florida, get your back and neck fixed properly at the place where these treatments were originated and created and pioneered. That way you get great results. Our patients have great results, very happy with their results. And you have a safe procedure, you're not going to get hurt. Now look at this tear here. Look at the blue. The blue is the tear. You can see the tear in the annulus. The blue stuff is the nucleus pulposus. Remember we saw that earlier when we did the dye. I got probably 3 minutes left. That blue dye is right there. That's the tear. And the white stuff is normal, but it's torn. That's the annulus. So I'm basically cleaning out the herniation, which is the blue stuff, and it's blue because it's stained blue by our dye. But that is nucleus pulposus that is herniated into the annulus fibrosus. It is herniated disc. As you guys know, what's called a slip disc or herniated disc. And the more of this stuff I can get out, the faster her disc will heal. Or sorry, his disc will heal. I apologize, his disc. Any questions?
At this moment, no current questions.
All right, why don't we show everybody the third most common cause of back pain, the piriformis muscles, and how we fix them.
Of course.
A piriformis muscle tear can cause lower back pain and sciatica. A piriformis muscle injury causes a tear, in which piriformis muscle inflammation causes back pain. And also, piriformis muscle inflammation may cause sciatic pain. The best treatment for piriformis muscle syndrome is the Duke piriformis release. From there, the piriformis pain is permanently eliminated. The advantages with the Duke piriformis release is that it's an outpatient procedure, which would take up to about 30 minutes. Minimal bleeding and pain after the procedure with an immediate recovery and return to work the next day, as well as a 99% success rate with permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
And we'll come back. You can see the piriformis muscles can be injured, torn. They can become very painful. They cause buttock pain, but also sciatic pain. And a lot of times doctors misdiagnose patients with piriformis syndrome as having a pinched nerve in their spine and doing spine surgery when they don't need it. So it's very important to get the right diagnosis. That's why we offer a free MRI review with Dr. Duke Majan, me, and I can tell you exactly why you're having your pain during that free MRI review. Costs you nothing. All you got to do is fill out the, my God, what a beautiful picture, huh? All you got to do is fill out the form online and get us your MRI images and report, and then we can do your MRI review and tell you why you're having back pain. All right, there's the fibers of the posterior longitudinal ligament behind the disc. There's some fat. You guys see the fat? Each of those little glistening things is a fat cell. Those are individual fat cells. And the reason there's fat behind the disc is you have a nerve back here, 2 of them, and those nerves use a lot of energy. And I just want to get the last bit of this herniation here. Now all of this will heal itself once we're done. And the main thing is the patient has to avoid re-injuring his disc, which is easy to do in this type of a disc situation where he's still got a lot of nucleus left. I don't want him being too active physically, like I don't want jiu-jitsu or heavy weightlifting, but he can go back to work tomorrow. He can drive a car tomorrow, go out to dinner. There's a lot of activities he can start doing tomorrow, and he'll be up walking around today. So, all right, any other questions?
At this moment, no current questions.
Let's show the audience the last most common cause of back pain, which is the SI joints and how we fix them.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Duke plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Duke plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
And good morning, I'm Dr. Duke Majan. 30 years of back pain.
Yes,
gone overnight.
Yeah, overnight gone. It was amazing. I've been dealing with it, suffering. If it wasn't for my faith and belief and my friends back home that supported me, my wife, I finally got here to the Duke Spine Institute, and what an amazing experience it's been. Had surgery yesterday. I'm up walking around. I feel great. My pain was usually from a 6 to a 10 out of 1, if that, and I'm just so grateful that there are gentlemen in this world that really care about people like Dr. Duke, and I can't thank him enough. I recommend this gentleman to anyone who's been suffering and doesn't know where to go for help. You know, I live in the state of Idaho. It's a great place to live, but probably one of the worst states to get hurt in.
Well, we are happy you're here in Florida to get your back fixed. And we did the Duke laser disc repair on your back and the Duke plasma rhizotomy on your facet joints. And you had a fusion done before, is that correct?
That is correct.
And we saw in your video when we were doing your laser surgery, you could see all the screws and rods, and you even have a broken screw at L5 on the left side, I believe. How do you feel comparing your fusion surgery with the Duke laser disc repair?
There is no comparison. 100% different. The fusion didn't help me, made me worse. It gave me a heart complication that I still deal with. But since I've been here, the people are outstanding in this facility, and I can't praise them enough. And Dr. Duke is truly a godsend for people that are suffering. I can say 100% honesty that I feel totally different person. I'm just so glad that I came here.
How does your wife feel about your new back?
She loves it because she knows I've been dealing with pain and depression. It's a hard thing to deal with. You know, it almost took my life. But like I said, with my belief in our Father and His Son, Jesus, has kept me here.
Amen.
And she's a big part of that. You know, I got to thank my friends like Dave Bowden, Dan Arnold, and Brad Russell. Those are truly my childhood friends that never gave up on me. People judge me on how I look, not how I am. And I'm a very compassionate person like yourself, and I want to help other people. I can't suggest Dr. Duke and his team here are world-renowned, outstanding, and everyone's so kind. I'm just so happy, you know, to have you on my side, and I can't thank you enough. You know, thank you, sir.
Praise God.
Amen.
And thank you for having faith in my team and our ability to help you.
Yeah, it is. It's they're, like I said, they're world-class people here. You can't go wrong. At least for myself, I'm just ecstatic. It's, you know, can't put it into words when you have no pain. I love it, and I'm just so glad that everyone helped me who was involved with me getting here, because I didn't do it on my own. I thank you all.
Well, thank you for sharing your story. I know it means a lot to people out there. We just want people to know that we can now fix back pain, neck pain. They just have to come here to Duke Spine and get the right treatment done, and we'll help them tremendously. Enjoy your travels home.
Yep.
And enjoy your new back.
And I shall. Thank you so much.
Yes, sir. It's my pleasure. All right.